So it's been a few weeks or months. Your tennis elbow isn't getting any better, and your doctor wants to give you a cortisone shot. Should you get one? Well, it's up to you, of course, but here are some things you may want to know about cortisone and why getting that shot could turn out to be a big mistake. Hi, this is Alan Willett from Body and Balance. From my experience and what I've seen of the long-term medical studies, it looks like getting cortisone shots could very well be the worst mistake that tennis and golfers' elbow sufferers generally make and often end up regretting, sometimes for years to come. Well, so what is cortisone? Cortisone is an injectable synthetic steroid drug that's been used extensively since the 50s to treat tendon injuries and a number of other joint and soft tissue disorders, including many kinds of sports injuries like tendinitis and tendinosis. You've heard all about the controversy around athletes using anabolic steroids and other performance enhancers to build their muscles up faster than what's normally possible, right? Well, cortisone is the opposite kind of steroid. It's a catabolic steroid. Instead of building tissues up, it breaks them down, as well as powerfully suppressing inflammation, not to mention inhibiting the immune system. Now, does that sound like something you want? I doubt you want to suppress your immune system or weaken or break your tissues down. Although we are constantly going through natural cycles of breaking down and regenerating cells and tissues, and our bodies naturally produce an essential steroid called cortisol that's involved in that process. Too much cortisol is not a good thing either. But to take a powerful, concentrated, synthetic catabolic steroid and inject it in or around a tendon can have very profound effects that can be very long-lasting, but not necessarily in a good way. Yeah, cortisone can powerfully suppress or eradicate any inflammation that's present where it's injected. And that might sound like a good thing, right? Actually, no, because inflammation is a natural, necessary part of our healing process. If you completely suppress your inflammation process, then you won't heal. Yeah, cortisone will suppress a lot of the metabolic activity in the area, including any inflammation, anything else that's causing pain, potentially giving you weeks or even months of pain relief. But what about healing? Does the absence of pain mean that your tendon's healed? Of course not, right? It's so deceptive because having less pain is one of the ways that we measure whether an injury is healing or not and getting better. But how can you help your healing process by suppressing and knocking out one of the most essential functions of that healing process? All too often people get the shot, it wears off a couple months later, and then they get another one and so on, only to realize 6 months to a year later that their tennis or golfer's elbow, it's much worse than ever. And here's the really sad thing. The medical studies, of which there are dozens, please see the links to some of them in my article, they tell the tragic story that, more people than not end up worse off. And then there's all the evidence that for some, the long-term outcome will involve much worse tendon degeneration, occasional tendon ruptures, and sometimes the necessity of surgery to fix the rotten mess. And will your doctor tell you any of this? Probably not. The best you're likely to get is, I think it's kind of a tired old rationalization about how you shouldn't have more than 3 shots in a year, or something like that. But knowing the true nature and purpose of this powerful steroid, I'm sure you'll think twice about having 1, much less 3 in a year. If you'd like more detail, including quotes and links to the medical studies, see the full article by following the link to my site. It's going to be either above or below this video. And while you're there, I also have a free video course called Tennis Elbow 101 that will help you get a better perspective and understanding of this stubborn, frustrating injury and help put you on the right track to treating it. I'll include a link directly to the free Tennis Elbow 101 course above or below this video as well. And if you happen to live in Marin, Napa, or Sonoma County, California, that's where my practice is, so I may be able to help you in person. My approach to treating tennis and golfer's elbow, it's all hands-on. I'm a neuromuscular therapist, and I specialize in treating muscles and tendons with advanced techniques that involve physical manipulation by hand. Think massage therapy, but a lot more advanced and precise. And if you haven't had any thorough, precise, hands-on therapy for your tennis elbow yet, then I'm confident you'll find and agree that this is the link you've been missing. Now, I'm not a physical therapist, so no doctor's referral is necessary, and insurance doesn't apply. But the upside is that I'm not under that increasingly leaky allopathic medical umbrella. And I have been able to help most golfers and tennis elbow sufferers over the past 15 years that I've been specializing in these problems. I also have what I believe is the best tennis elbow and golfer's elbow video self-help program online, which you can do at home to complement the treatment you receive here at Body and Balance. And the good news is that even if you don't live in the Marin, Napa, Sonoma County area near my practice, and you don't want to travel here, you can still enroll in my tennis elbow classroom and use my programs at home to treat yourself. Again, just follow the links above, below, or at the end of this video. And here's to breaking your vicious tennis elbow cycle.